Alright, now before we go into the nitty-gritty aspects of all the different policies, I just want to give you kind of a general overview of health insurance in the US. So what are my different options? So we've got about 300 million Americans, and around 15% of those at last count were uninsured. So what does it mean to be uninsured? So let's say I don't have health insurance, I'm walking down the street, I get hit by a truck, I break a couple ribs, I go to the ED, I get treated for my acute injuries there, and then the hospital discovers I don't have health insurance. So what now? Well, I don't have the money to pay for it, because healthcare in this country is ridiculously expensive unless it's paid for by the insurance company. So there are two options. Either the hospital could pay for it or the government can pay for it. So the hospital could just say, okay, this is unreimbursed care. We're going to cover the bill. Or they could go to the government and say, hey, this person is eligible for one of your public programs. So could you cover some of this expense? So, and if the government pays for it, then indirectly people who pay taxes are paying for it. So nobody was really happy with the idea that some people were getting payouts from the system without paying into the system. So this is the origin of the so-called individual mandate. Individual mandate. And the individual mandate is basically a penalty if you don't buy health insurance. And the way this works is that in 2014, 2014 here, and then 2015 here. So in 2014, if you don't buy health insurance, or if you don't have health insurance already, you're going to need to pay, when you file your 2015 return, a $95 penalty. So $95 or 1% of your income, whichever is greater. So let's say that I make $50,000 a year, $50,000. So I would need to pay $500 as a penalty on my 2015 return if I didn't have health insurance in 2014. Now in 2015, the penalty goes up. So in 2015, if I don't have health insurance, I'm going to need to pay when I file my return in 2016, I'm going to need to pay $695 or 2.5% of my income, whichever is greater. So if I made $50,000 a year, so $50,000 a year, then I would need to pay, this time I would need to pay $1,250 as a penalty for not having insurance. Now this is getting a little bit more expensive at this point. So for some people, you wouldn't need to pay much more than this for a health insurance policy. So what's the point of just throwing money into a hole or giving money to the IRS when you could just have services for the money as well? So you can see that there's going to be less and less incentive to not having health insurance, apart from the obvious risks of not having health insurance, both financially and for your health. So as we move along, it's going to become less and less of a good idea to not buy health insurance. So this 15% is likely to go down with time over the next few years. So that's our 15%. And then the other 85% of Americans are insured, and they're either going to be insured under public or private plans. So the public plans, this is going to be around 30% of Americans. And I know these numbers don't add up. There's actually some overlap between them, so kind of bear with me there. But let's go through the different public programs and kind of figure out what individuals are going to be covered under each of those programs. So Medicare is going to be basically for old people, people with a disability, typically a major disability, and then people who have kidney disease. These are the major categories. And ALS is another category, although there's going to be a smaller number of people with ALS who will fall under Medicare. All people with ALS will fall under Medicare, but it's going to be a small number of people relative to these other groups. So old people, if you're greater than 65, you're eligible. Greater than 65. Disability, so this is typically severe disabilities. Let's say that you had a spinal cord injury after a car accident and you couldn't move your legs, then you would probably be covered by Medicare. Kidney disease, so let's suppose that you have diabetes, long-standing, and you have end-stage renal disease and you need dialysis. So Medicare should pay for that. And then ALS, there are many expenses associated with that, and these should be covered by Medicare. Now Medicaid, so these look kind of similar. You've got CARE and then CAID, but these are actually two very different programs. So Medicaid is for poor people, where poor is defined as 133% of poverty level. So 133% of poverty level. And I'm checking the most recent figure that I have, which could be wrong, but I think it's right, is $23,550. So $23,550, which comes out to $31,321. And this is for individual, by the way. This would not apply to families. There's different numbers for that. But if you're an individual and you make less than $31,321 per year, then you should be eligible for Medicaid. Now, SCHIP is kind of interesting because it's sort of an extension of Medicaid for families who fall above, it's going to be a different number, but the family maximum income, but still have major expenses for their kids. So SCHIP is designed to cover that, and you can look up more of the details of SCHIP on their website. Military has a couple different areas, and by the way, all these are kind of generalizations. There are additional complexities to consider, but military is going to be basically two categories. So you've got your active duty, and then you've got your vets. So active duty is going to be covered by MTFs, military treatment facilities, and also TRICARE. These are the major options for active duty folks. And then veterans are going to be covered typically. Now, not everyone is eligible, but most people are. So Veterans Health Administration, the VA medical centers for military vets. All right, so now we're moving into the private category. So we've got our 85% insured, and we said that most Americans, 55%, are covered by employer-sponsored health insurance. So employer-sponsored health insurance is a requirement. The employer has to offer that insurance if they've got 50 or more full-time employees. If they don't offer health insurance and they've got 50 or more full-time employees, then they need to pay a $2,000 penalty. So a lot of employers, obviously some employers are doing this, and then some employers are moving more to a contract-based model, or at least to not having full-time employees in order to avoid this penalty. But most Americans are going to be covered under employer-sponsored health plans. Now, associations is kind of interesting. So remember that health insurance came from the same sort of origin and idea as other types of insurance. So, for automobile insurance, if you have several accidents in a year, then your premium is going to spike. And the idea with association plans is kind of similar. So let's say that you're a member of the American Dental Association. So the insurance company has made a calculation that dentists are less likely than the average population to incur significant medical expenses. So maybe you're eligible for a lower rate as a member of the American Dental Association. And there are many other associations for which you could get lower rates. That's just an example. And then, the last option is individual. It's not by any means an inferior example. It's just the last one that I'm getting to here. This would be common for people who are self-employed or contract workers. This number is probably going to be going up as employers try to avoid that penalty by reducing their number of full-time employees, but I'm not sure of that. But self-employed and contract workers, and the important thing for these, it's very easy to do. You can go to the exchange, or you can go to a private health insurance company's website and sign up for a plan. Depending on whether you're a younger individual, healthy, or if you're a healthy individual versus somebody who has a lot of medical problems already, you can choose a plan that makes the most sense. High deductible if you're young and healthy, maybe lower deductible if you have more kind of recurring medical expenses. But the important thing to remember is that you just need to sign up, or you're going to incur these individual mandate penalties as time goes on.